And first off, and again, we're being a little extra careful just because we have a camera here. I'm gonna do the.
You're gonna do Kelly's oil?
Kelly's oil.
Kelly style oil?
Ayurvedic style.
Ayurvedic style, that's right. Although the Ayurvedic people might say, no, that's not our style. It's more like Kelly's random style.
Soft bends. Is that comfortable? Absolutely amazing way to access into the neck and do this work. And it's nice in the sense that this is the side that we worked on the back. So again, that fossa, if you ever need to access it, sorry, I don't have the best shirt, but you can come in and manually move the shoulder up by bracing like this, and you can sink in and find right where that fossa is for that scalene attachment into the first rib. How does that feel?
Oh God, it's so good.
So this is kind of work that you can do in with the breath. So now that I kind of know where that is and have an idea, I can do what Kelly did and take that cup and utilize it into that space. Can you read what the specific
Absolutely
was? Just because I'll get carried away and start going in a totally different direction.
I just want to say too also, if a cup is really hard to place on a certain aspect of the body, you can place it somewhere that's easier and then move it into that space. So
yeah,
that's a great technique. Thank you, Sarah.
Yeah.
It helps so much to know that you can do it that way. And especially with light and medium, it's very easy to do that. So okay, so we've already done posterior work. So we're going to skip step 1 because we did that before. Step 2, light cupping with focus on the lateral side body. The whole hypochondrium to the axillary region on the same side as the pain.
Are you comfortable with your arm up like this? I've got you secure right here. I make sure that I let her know that I'm secure in and around this space to the point where I can even, especially being extra protective, bring the sheet up like this so I make sure that she stays covered. And now I have access right in here. I can take my cup, follow down. Notice I have the sheet kind of almost directly at that border or boundary of that kind of yin purpose into that side body. Sorry, as I keep doing that.
Tickling her.
I'll stop. Sorry, Quincy.
You might need some lubricant there. I
Right,
don't know.
but I'm gonna come right in. Actually, that's a great point. Are you okay with your arm right?
Do you want me to? I can hold it up a little bit better.
No, we're good. Okay. Multiple people.
It takes a village.
Normally this would be a little different in practice, but we're being careful with the camera. Okay. Thank you, Kelly, for the lubricant. Okay, so I don't want to go directly into the axillary region. When we say that, we're talking about this space right in here. We're talking about subscap, serratus anterior, great for breath work. So her scapula is right in here. So I'm going to be coming into this space.
I love it. All the way, you can utilize all the way down to the rib bases. Yeah. So Amber's doing beautiful work here.
So this is scapula right here. Okay. Read that again.
Lateral side body, hypochondria to axillary region, light cupping, focusing on this area. And I would say it's not written here exactly like this, but there's a couple ways you can do this. Just like Amber's doing, you can place multiple stationary cups in this area, or you can move all around this whole area and find where the stationary cups want to sit.
Right here. And just go ahead and rest that and let that be with me. So again, notice I'm not in the axillary region. I'm just kind of behind it into this lateral side body.
Yang tissue versus yin tissue.
We're getting some good Patika. How you doing in here?
Oh, it's so good.
She's a climber, so she's probably loving us right now.
Amongst other athletic endeavors that are also, she's amazing at all of it.
Oh, thank you.
But massage therapist climber, woo.
So yeah, this is the step 2 part. This is working on the side body, the axillary region, the ribs, and this is a different channel system, the gallbladder channel, but we see gallbladder channel usage a lot more in the low body, so we didn't give you that chart today. Again, if you're interested in the meridian theory, that's like a whole class of its own.
So Kelly, I don't know how well you can get to this.
Okay, I'll come around actually.
Or if you can
I'm
just
gonna come around and give us a different image. Sorry for the movement. We'll get there, we'll get there.
I just really want, this is a good petechia spot, and I want you guys to know that utilizing side lying can be really beneficial because this mark has a lot of petechia and is for expressing kind of that cold.
Beautiful. Expressing cold too, she says, which we've seen in other areas for Quincy today.
So we wouldn't have really been able to access this as well from an anterior or a posterior position, but we can really get into it from a side lying. And again, obviously, I have her just resting her hand. I wouldn't have her hand in this position if she was already experiencing impingement or numbness, pain, tingling down the arm. This is a separate anterior shoulder pain issue. Okay.
Also, if it's okay for your client, sometimes you can just have them lean their arm over the front of the table. Sometimes that works too.
Yeah, if I had a pillow, that might even be a little bit easier. Yeah.
Yeah. You guys know, you're massage therapists, how to make your client comfortable like this.
What was the next?
Yes.
step for that?
Okay.
Sorry.
So that's step 2, working the side body, lateral side body. Step 3 is coming back and working light cups to the anterior chest, to pec minor, to subclavius, to the superior attachments to pec major, and the supraclavicular fossa. Light cupping over these areas. So remember not to apply any stationary cups over catchment areas of the lymphatic system. This is really, really important, is to watch the axillary region when you're doing this work. But now we're moving into the anterior applications. Anterior chest, pec minor, subclavius, pec major, superior attachments, subclavicular, supraclavicular fossa, and then just noting when you're doing that side body work to not do anything that's over the catchment sites that's strong or stationary.
Just because I know she needs it, and I want to show how you can really get into those scalenes.
Awesome.
And some of those attachments real quick, and then I know for time we'll.
Always when you're working with the scalenes, you're watching out for the arteries.
Arteries right here. How you doing with those?
Really good.
You can also have this be movement oriented. And again, nice thing with like either a squeeze pump or a silicone is if it pops up, especially we talked about like convexities, concavities. When you're doing movement, it is easier for them to pop off. So you can just put them back on.
She looks peaceful right now.
I feel at peace.
Okay, while Amber's finishing this particular style, just a few notes from your handout here. Always keeping in mind that working the posterior aspect of the shoulder is beneficial for the anterior and vice versa. Absolutely always avoid any direct cupping or even really close to the side of the carotid artery, jugular vein. And then little things just to remember as you go along that you want to educate your clients and your patients about the importance of self-care after cupping therapy. So after you're finished cupping, remind your clients to keep their marks covered for 48 to 72 hours. This is to allow the pores, which have been very strongly manually opened, to reclose themselves back down. And that's how long it takes, believe it or not. No exposure to wind, cold, extreme heat, or chemicals. So that includes blowing fans in your office. It includes wind outside, so you might need a scarf. Extreme colds of heat, that includes like the cold shower or cold water dunk. It includes getting a sunburn. You definitely don't want a sunburn over this stuff. Chemicals, pools, hot tubs. Also, most lotions have a lot of chemicals in them. So avoiding those kind of things. The cupping marks can last for a couple weeks. Typically, they fade in about 10 days. But people should know that, and especially check in with them to make sure they don't have like a photo shoot for their new engagement or a wedding or who knows what.
Stress.
Yeah, you don't want to do something like that to a person without their permission because they might have something coming up. Also letting people know that this is a detoxification process, and because of that, they need to hydrate, first of all, but they can also feel fatigued and sore and uncomfortable. Even have some people sometimes will even have a visceral response. They might get headaches, they might get nauseous, they might feel dizzy. All of these things can happen, but usually that's just in the first 24 hours, and then that starts to clear, especially with more hydration. And then finally, that this seems like, you know, a few minutes of a topical manual therapy that's relatively superficial. And also your patients love it, so they'll beg you for it all the time, even if it's not necessarily the best thing for them every time you see them. But just to remind them that this is starting a process that lasts for a couple of weeks, and what's happening superficially is reflecting what's going on deep in the body's metabolic processes. So just as reminders there.
No, those are great reminders. Okay, so let's go ahead. We're going to do kind of what we did before, but we're going to take a little bit of a shorter break, at least from our end. So obviously, if you're getting someone off the table, make sure your video is off, as well as you keep yourself on mute. We're going to turn our video off. We're going to make our break just a little bit quicker this go around, and then we're going to come back for a final closing and get to some of those questions that we couldn't answer. So we'll see you guys in about 10 minutes. Okay?
Thanks,
Thank you.
everybody. 10 minutes before we come back.